Welcome to DoodleMed Insights.
Today, we will be discussing congenital heart disease, which is the most common cause of childhood heart disease in the United States. Approximately 90% of cases are considered idiopathic, meaning the cause is unknown, while 5% are associated with genetic diseases, such as trisomies. Viral infections like congenital rubella, or exposure to drugs and alcohol during pregnancy. Let's start with right to left shunting. It is characterized by the movement of blood from the right side of the heart to the left side without passing through the lungs. This results in a condition known as early cyanosis, where patients may present as blue babies due to oxygen-poor blood circulating in their bodies. Some examples of conditions associated with left shunts include Tricuspid Atresia, Tetralogy of Fallot, Truncus Arteriosus, and transposition of the great vessels. Left to right shunting involve the movement of blood from the left side of the heart to the right side. This leads to late cyanosis in patients, where they may present as blue kids due to oxygen-poor blood mixing with oxygen-rich blood. Over time, right shunts can lead to secondary pulmonary hypertension and potentially result in the reversal of the shunt, known as Eisenmenger syndrome. Common conditions associated with right shunts include ventricular septal defect, atrial septal defect, and patent Ductus arteriosus. Tricuspid atresia is a congenital heart defect that arises from the absence of a communication between the right atrium and ventricle, which occurs due to the developmental failure to form the tricuspid valve, an essential component of the heart structure. In addition to the absence of the tricuspid valve, tricuspid atresia is often associated with other defects, such as right ventricular hypoplasia, which means that the right ventricle is underdeveloped and unable to function properly. Furthermore, an atrial septal defect is commonly present. The prognosis for individuals with tricuspid atresia is poor without surgical intervention. Tetralogy of Fallot is the most common cause of congenital cyanotic heart disease. It is characterized by a set of 4 specific heart defects. These defects are a combination of right ventricular outflow obstruction, right ventricular hypertrophy, ventricular septal defect, and overriding aorta, collectively known as the classic tetrad. As a result of these defects, individuals with tetralogy of Fallot may experience a range of clinical findings, including cyanosis. Additionally, they may suffer from shortness of breath and digital clubbing. Truncus Arteriosus involves a failure in the development of a dividing septum between the aorta and pulmonary artery, resulting in a common trunk for both of these major blood vessels. This means that instead of the normal separation between the two, blood flows directly from the pulmonary trunk to the aorta. As you can imagine, this abnormality can have serious consequences for the affected individual. Infants born with Truncus Arteriosus, often present with early cyanosis and symptoms of congestive heart failure. The prognosis for individuals with this condition is generally poor without surgical intervention. Transposition of the great vessels is an abnormal development of the truncoconal septum, whereby the aorta arises from the right ventricle, and the pulmonary artery arises from the left ventricle. The risk is increased in infants of diabetic mothers. Affected babies develop early cyanosis and right ventricular hypertrophy. To survive, infants must have mixing of blood by a ventricular septal defect, atrial septal defect, or patent ductus arteriosus. The prognosis is poor without surgery. Ventricular septal defect, which consists of a direct communication between the ventricular chambers. Ventricular septal defect is the second most common congenital heart defect. There are two types of VSD, a small and a large VSD. A small ventricular septal defect may be asymptomatic and close spontaneously, or it may produce a jet stream that damages the endocardium and increases the risk of infective endocarditis. A large ventricular septal defect may cause Eisenmenger complex, which is characterized by secondary pulmonary hypertension, right ventricular hypertrophy, and late cyanosis. Large ventricular septal defects can be surgically corrected. In both types, a systolic murmur can be heard on auscultation. Patent ductus arteriosus is a direct communication between the aorta and pulmonary artery, due to the continued patency of the ductus arteriosus after birth. It is associated with prematurity and congenital rubella infections. Clinical findings include late cyanosis, machinery murmur, and congestive heart failure. Eisenmenger syndrome may develop as a complication. Atrial septal defect is a direct communication between the atrial chambers. The most common type of ASD is an ostium secundum defect. Complications include Eisenmenger syndrome and paradoxical emboli. Eisenmenger syndrome is a condition where the direction of blood flow within the heart is reversed, leading to decreased oxygen levels in the blood. Another complication to be aware of is the potential for paradoxical emboli, where a blood clot from the venous circulation can pass through the ASD and enter the systemic circulation, potentially causing a stroke or other serious complications. One specific type of congenital heart disease is coarctation of the aorta, which is a narrowing of a segment of the aorta. There are two types of coarctation, preductal and postductal. Preductal coarctation, also known as infantile type, is often associated with Turner syndrome and involves a severe narrowing of the aorta proximal to the ductus arteriosus. This narrowing causes a decrease in blood flow to the lower extremities, leading to weak pulses and cyanosis. Infants with preductal coarctation typically present with congestive heart failure and have a poor prognosis without surgical correction. Postductal coarctation, or adult type, causes a stricture, or narrowing of the aorta, distal, to the ductus arteriosus. This can present in both children and adults, with hypertension in the upper extremities, and hypotension, and weak pulses, in the lower extremities. Collateral circulation may develop through the internal mammary and intercostal arteries, which can be seen on chest X-rays, with notching of the ribs, due to increased blood flow through these arteries. Complications of coarctation of the aorta can include congestive heart failure, intracerebral hemorrhage, and dissecting aortic aneurysm, all of which are related to the increased pressure and strain on the heart and blood vessels. Overall, understanding the different types of congenital heart disease, such as coarctation of the aorta, is crucial in order to diagnose and treat.
Thank you for your attention, and I hope you have gained valuable insight into this important topic.